I'm Dave Duplay. I'm here with Sandra Quinn. We're going to talk today about some of the work Sandra's doing with men with bladder cancer and prostate cancer. And I know you have this program, Decision Navigation, I think it's called. And can you share with us what that is and how that works?
Okay, so Decision Navigation is really a way of enabling patients to make treatment decisions. And it facilitates them and the consultant to share in the decision-making process. So what happens is that the patients are interviewed by a trained navigator, and I'm trained to provide that to a wide range of individuals. They don't necessarily have to have expertise in medicine or anything like that. And we do a structured interview really with them. And during the course of that, the navigator is building up a document for the patient that basically contains all of the questions and concerns that they have about their cancer, about the treatment options that are available to them, about their goals and preferences, and how each of these might have implications for the treatment decisions that the patients have to make.
And Sandra, what are some of the questions that you would ask a patient during that interview process?
Okay, so prior to the start of the interview, we ask patients to come up with 3 main questions that they would like to ask their consultant before their kind of appointment.
And by consultant, you mean a healthcare professional that they're going to be in consultation with?
Yeah, in the main, it's with surgeons or individuals in radiotherapy. But it can be used by nurses and various other individuals, because the system itself isn't just tailored to the purely medical component of it. It can include issues and concerns that have things to do with the patient's financial situation, or to do with any sort of emotional problems that they might be having at that time. But most of it is centred around facilitating the consultant, who is a surgeon, for example, to enable the patient to talk about, which treatment option would be best suited to them.
And so these questions that are asked, you print out a report card for that patient, and that patient uses that as a discussion guide in the consultation to make a treatment decision.
Yeah, I mean, the consultants still follow their kind of natural way of explaining their biopsy results and the treatment options that are available to them. But then they can use this to guide any additional information that they feel they may not have covered for the patient, or to clarify things as well, because patients do lose a lot of information from their initial biopsy consultation with the CNS nurse. So they're given their diagnosis, then they're told a bit about the treatment options that are available to them, but they lose information because clearly they're very anxious about the fact that they've been given this diagnosis. And we know that patients say, I just completely went blank. So this, in a way, facilitates them to be prepared, if you like, for their consultation and the point at which they have to decide what they want to do. So yeah, it's a way of preparing the patient.
Now, when you look at the output of these questions, how much is based on quality of life and life goals versus the clinical aspect of purely making a treatment decision?
It's a combination of the two. I think that's the beauty of this, because it includes both of these things. So we ask patients about their current situation, and it particularly focuses on treatment options. So their treatment, their biopsy, their results. And that gives us a sense of what the patient understands about the kind of purely medical side of things. But then we delve much deeper than that. We'll ask patients about, so are there any goals or preferences or priorities that you have at the moment? And obviously patients say things like, I want to get well, I want to feel better. Sure. But there are other things as well that they bring up. It could be about the fact that they enjoy their job and they want to continue working. They don't want to be in hospital for a long time. They want to know about any pain medication that they might be on. I mean, there's a whole range of things that they bring up that some of them are medically based, but some of them aren't. They could be about financial problems as well. So there's a real mix of having medically based questions and having more kind of like lifestyle based questions combined.
You know, it seems to me that a form of this nature could cut across almost any condition, not just isolating men with bladder and prostate cancer. Are you seeing this form and this methodology being used in other areas of medicine?
Yeah, I think you've nailed it, really. We have used it in other cancer types before. So it's been used in breast cancer, colorectal cancer and neurological cancers, and we've only just started to really move into prostate and bladder for the first time, actually. But because of the way that it's structured, it's not a cancer decision aid, it's a health decision aid, it's a treatment decision aid. So it can cross a wide range of different conditions, and I think it is particularly useful for patients who have a wide range of treatment options that they have to select from, and I think that's why it's particularly useful for men with prostate cancer, because they could have a full range of different choices to make, anything from I don't need to do anything just now because my cancer isn't aggressive, right through to, well, I've got to decide between surgery and radiotherapy. So, it really does facilitate them in those circumstances, but I believe it could be used in any chronic health condition.
Well, Sandra, I think the work that you're doing is very much needed. I want to wish you continued luck with your project, and I want to thank you for stopping by.
Thanks very much.
Thank you.